you're going to take a shower with Tide and bleach and fabric softener, and that's going to keep you from getting the coronavirus. But certainly there seems to be a definite area of concern. And I want to ask both of you, Dr. Albright and Dr. Audrey, do you think this level of preparation is based on fear, or do you think people are really preparing in case they have to lock down in their respective places of residence? And I'll start with you, Dr. Audrey.
I would say probably fear, because the government hasn't really came in and they are trying to get the message across, but in a way they kind of like inciting fear, because they weren't ahead of it like in some of the other countries and getting the message out to the public. But in case you are quarantined for a couple of weeks, you do need supplies, but not the way the hysteria. But it depends, like I said, on good hygiene practices in your immune system. If you're healthy, you want to stay healthy. It's only when you compromise, but you have people who still don't wash their hands after going to the bathroom. There are a lot of people who do a lot of things. You'll be surprised. In the dental office, people can come in and take a denture out, but they won't go to the restroom and wash their hands. So you're talking about a lot of cross-contamination in the office. So we're always constantly wiping down door handles. So certain things you just have to have good hygiene and just don't panic.
And in my estimation, are you finished, Dr. Audrey?
Yes, I am.
Okay. In my estimation, Mike, just think about it common sense wise. Number one, what is bottled water going to do?
Right.
And we've already told you that the virus can only get into you if it's on a surface and you put your hand on the surface and then put your hand in your mouth. It's not in the air and it's not in the water.
It's not waterborne. It's not waterborne.
No, it's not. And so, like I said, if you want to know, this is just panic, because it doesn't make any sense, any medical sense, because the virus is not in the air. It's not in the water. So what is bottled water going to do? Nothing. You're just wasting your money. Now, if you wash your clothes in hot water and detergent, that's fine. But most people wash their clothes anyway. So most of the things that the people are doing, except the sanitizers, that makes good sense. Hand wipes, that makes good sense. But in terms, like I told you, the mask sometimes is more trouble than it's beneficial, because the mask, people don't understand. Knowledge is what is lacking here. The knowledge is that you don't put the mask on because the virus is in the air. You put the mask on to protect your mouth and your nose from you infecting it from a contaminated surface. So bottled water is not going to help. You can buy all the bottled water you need. And if you think that if there's no water supply, that you're going to be able to live off bottled water for a month, or you're not. So, it really doesn't make common sense. It's just a panic mode. I didn't go out and buy any water. I have the usual. I did get a little sanitizer, wash my hands good, but it doesn't, and that's the thing. People have to realize you're not helping yourself by stocking up on bottled water. What you need to be doing is concerned about sanitizing your hands, keeping your hands clean. Like I said, not shaking hands, not, as you're walking along, how we usually run your hand along the rail or something like that. Keep your hands to yourself. Don't contaminate your hands. Realize that if the virus is going to get into you, it's going to be on your hands and in your mouth and your face. Keep your hands out of your face, out of your mouth, out of your nose, and you'll prevent yourself from getting the virus, and that's what's important. But people are missing it. Like I said, I'm an obstetrician. I have been trying to wonder for 30 years. First thing you know, when somebody has a baby is going to be born, they say, boil some water.
What does
I
that
have
do?
never been able to figure out what that boiling water is for.
They want to eat some.
know,
Yeah, I thought it was for serving
like
coffee or something.
For water,
coffee.
but I'm saying common sense
Sure.
and understanding how the virus is transferred from one surface to another is the take-home point here. Not buying a bunch of stuff that's not going to do any good in the first place.
On a I guess a larger scale, not so much on this particular coronavirus, but in general, just as a professional opinion, what do you hear people talk about opioids and all those things where people are abusing those, but on some level, do you think antibiotics have caused a type of that we built up a tolerance as a country or a nation to that makes it harder to combat these things when they come up?
Absolutely. But another important distinction is to realize that this is an infection, but it's not a bacterial infection. Therefore, antibiotics and those kind of medicines have no effect on a virus. Like when you get cold, people run to the doctor to get antibiotics. It has no place in a virus. It's totally ineffective. And what you do is exactly what you said, is we overuse antibiotics to the point that they don't work anymore, because when you use an antibiotic against a bacteria, the bacteria start changing so that the antibiotic doesn't kill it. And if you just load the body with the same antibiotic, pretty soon it's not going to work against that particular bacteria. Every time we get a specimen now, we do a test on it, and it tells you which antibiotics that aren't affected by this bacteria anymore, because we've used them so much, the bacteria becoming immune to the medicine. So one of our big mistakes is that we overuse antibiotics, and doctors are obviously the biggest culprits because patients demand it, but we're doing ourselves a disservice by overusing antibiotics. So that point is correct. And the more important thing is, this is not a bacterial infection, so antibiotics shouldn't even be in the conversation.
Right. And that's the good point. You say, viral kind of has to run its course, and bacterial is totally different. What things would you all recommend for folks to kind of strengthen their immune system, so that they are, better prepared, that we are, thinking more in a healthy manner? Maybe that'd be a positive thing that can come out of this coronavirus thing, is that people begin to obviously take better care of themselves from a hygiene perspective, be mindful of kind of surfaces that they're touching. Those are positives. But I think it's also an opportunity for people to start to explore with a real emphasis on how they can better strengthen their immune system.
Well, Dr. Audrey mentioned. Go ahead, Dr. Audrey.
Well, just have a well-balanced meal, nutrition. If you have to have a supplement or take vitamins, take that. That would helpfully improve your health. Help eating a well-balanced diet with fruits and vegetables and minimal meat. But some people, diet consists of more meat than vegetables. You just want to make sure that you just eat properly. Have the meat should be the least amount on your plate. But now with the coronavirus, it might be harder to get vegetables and fresh fruit because people might be quarantined, or people can't go out. So you're gonna have to rely on frozen and canned foods, things that you have in stock in case you can't get out. But the main thing is to eat a well-balanced diet. If you have to take some type of vitamin or supplement, go ahead and do it.
Okay.
And I make sure, of course, exercise. You probably have to walk, exercise in your house. So you always want to make sure you boost your immune system. Like Dr. Albright was talking about using zinc. There's controversy over it, but, certain supplements do help.
What's the controversy?
To boost your immune. Huh?
What is the
Just
controversy?
like vitamin C. Then it doesn't. For some people, it doesn't work. They don't see any improvement. It depends.
Oh,
It
gotcha.
depends on. Yeah. So some people say it do. Some scientists and some scientists say it don't. Just like vitamins and supplements. There are two rules of thought. Some scientists like it. Some health professionals don't. But we know that vitamins do work. We do know it working in some individuals. So, and the thing is just you have a healthy strong immune system. And if you do have a compromised immune system, you can't go out. You're going to have to just stay in.
Wow. Well, I tell you, Dr. Audrey, the various things that people are doing out here, when I hear you talking about the vitamins and those types of things, I've heard everything this week from, even the type of clothing people wear. And I'm not kidding. In terms of these are ways to keep yourselves from getting this thing through skin to skin contact and all kinds of other things. But from a medical perspective, from the reality, from you and Dr. Albright's perspective, what can a person expect? For example, let's say, Joe goes to the hospital. He's not feeling well. He's got some flu-like symptoms. And what can Joe expect to happen to him when he walks through the door?
Well,
dental off. Oh, go ahead, Dr. Albright.
Well, I think there are two perspectives that Mike is saying. And one, Mike, would be if they go to a dental office or a private medical office versus the hospital. And I would say that I would imagine that as time goes on, like Dr. Audrey mentioned earlier, that the clerk or the secretary in the office is probably going to become more of a screener. And if somebody's sitting in the lobby coughing or something, they'll probably ask them to head on over to the ER or urgent care so that they can be screened to see if they do have something that's going to be harmful, because we're going to become less tolerant of somebody who's obviously sick coming to work or, being in your office or around you. People are going to just naturally become more reticent to having those people around. But if you go to the emergency room and you have flu-like system, expect to be screened for the coronavirus. But, again, this is not anything that we're going to be the hospitals are trying to control panic so that, people aren't, because, this thing can get to the point where people become violent when somebody's around them that's not well. And we certainly don't want anything like that to become, common. But what we need to do is just, like I said, precaution, precaution, precaution. Keep yourself from contracting the virus because you're going to give it to you. And going out and all this stuff, just keep your hands to yourself, keep your hands clean, and remember how the virus is transmitted. Like, again, I think that the education has been lacking in terms of getting this information to the public. Everybody should know that the virus is on surfaces, and when you touch surfaces and put it in your face, you're going to give yourself the virus. I don't hear that nearly enough in terms of how everybody's afraid of getting it, but nobody's asking or being told how you get it and how not to get it. And we're trying to get that message out on your podcast. But I think that's probably the most important public health issue right now, is how can you prevent yourself from contracting this virus? And that is by, not giving it to yourself, understanding where the virus is and how not to put it in your body.
So what would happen, and how do they get to the point where they say, okay, Mr. Smith, you have tested positive? What does that process look like? And then what happens from that point?
Okay, well, this process is brand new and it's being developed as we speak, Mike. The hospitals are forming teams and, obviously you can't quarantine everybody,